The fight against COVID-19 is getting tougher by the day. While a lockdown has been seen as an effective way to stop community spread, how seriously are people taking it? A 17-year-old from the city has conducted a survey that throws up some interesting insights into how the outbreak has affected people psychologically, while also pointing out the weak links in the implementation of the lockdown.
As India breached the 3,000 mark in the number of people affected by COVID-19, the gravity of the situation became clearer to the people of the country. The lockdown notwithstanding, the number of people affected by COVID-19 has been on the rise. A 12th grade student from Bengaluru, Ruhi Mehta, has conducted a survey on the perception of the people on COVID-19 and the lockdown. A total of 4,557 people were surveyed over 3 days, from March 20th to 23rd. The survey shows that a majority of people see COVID-19 as a real threat. The survey shows that 81% of the people view COVID-19 as a real threat, while 19% don't view it as a threat at all. A whopping 85% of the people are aware that they are at risk of being infected with COVID-19, while the rest 15% believe that they or their family members could not be affected. While the importance of social distancing has been spoken of extensively, 15% don't believe in this segregation. The most important part of the survey is that only 68% of the people admit to be following the recommended measures, while 32% of the people admitted that they are not taking the measures seriously. This could be a failure point in the lockdown that could in turn make the entire exercise counterproductive. Another important aspect that has been suppressed in the focus on the outbreak of COVID-19 is the psychological impact it is having on people. Out of the total number of people surveyed, 85% admitted to being scared. Out of the entire sample size, 40% felt hopeless, unsure of what the end of this pandemic could be. 36% of the total surveyed also felt overwhelmed by the information available, a case of excess information being stressful for people. 17% were not aware of what the impact could be. Interestingly, a majority of people were in favor of the lockdown in dealing with the pandemic. There's a mixed response to the medical preparedness in the country. 53% of the people had faith in the preparedness of the country, while 47% did not have faith in the system. With the bulk of the treatment being undertaken by the government hospitals, 60% said they would prefer self-paid treatment at a private healthcare over free treatment at a government facility. As the country stands united in its fight against the pandemic, it's important to know what the common man thinks of the measures that have been taken by the government, because the more people understand the importance of it, the more effective these measures would be. We spoke to Ruhi Mehta, who surveyed the people to get these results along with her parents, Dr. Ravindra Mehta, the chief pulmonologist of Apollo Hospitals, and Dr. Hetal Mehta. In her words, the absence of ground-level data has created a vacuum to guide measures and target resources necessary to tackle COVID-19.
So during the time I've created the survey, India's number of coronavirus cases wasn't very high. It was around 200 or so. And schools had just been shut down and people were being encouraged to work from home. At that time, social distancing and segregation had also begun being implemented. That made me curious. What do people feel like themselves? Being at home, what do they feel about the measures? Do they think that they're worth it? Do they think that the virus is a threat? How are they managing sitting at home all day? And to get answers to those questions, I created the survey.
Though this survey was conducted in mid-March, it could be a key indicator of what Indian population thinks of the pandemic. It also provides valuable information that could help change the guidelines to better suit the situation.
Of all the respondents, 91% did believe that the coronavirus was a threat. On the other hand, only 85% were afraid of getting it or of their families getting it. That means that there is a 7% gap in there between people who believed that it was a threat and people who were afraid of getting it.
Though India is trying to flatten the curve, the number of positive cases can go up drastically in the coming days as the number of testing also increases. This could also affect the psychology of not just people affected by COVID-19, but also several others who are locked in their homes, knowing very well that the situation could perhaps go out of hand if we are not careful enough.
Yes, my parents did help in the survey a lot. They added some questions, helped me out with the wording, and my survey and questions were approved by both of them before it was sent off. And my father especially has been doing a lot of work around this time.
Needless to say, the survey aims to help the authorities get a better understanding of the problems that are currently not in focus, but could give a better understanding of the impact it is having on people.
32% of the people had said that they do not follow all of the segregation measures. That's an entire 1/3 of the respondents. That means that the 1/3 of the people are not following measures, and these are the people who awareness programs need to target. These are the people who must be convinced to follow the preventive measures. Additionally, there's a huge psychological impact that must be addressed that the coronavirus is taking upon society.
While majority of the people did not have faith in the medical facilities in the country, this is the time to show that India is doing its best to tackle the outbreak. Systematic surveys like this, perhaps with bigger samples, should be encouraged to make the implementation effective and subsequently defeating the pandemic. A Newsland report.